Hi guys, I'm Kaechele, and for my presentation, I interviewed Susan Molinex from an Athletico clinic in Clinton, Michigan. So let's go ahead and get started. So the beginning, there's actually 600 Athletico locations throughout the country, and I initially asked her how she was interested in doing physical therapy as a profession. She was injured badly in high school playing sports. And through her injury, she visited the same physical therapy clinic. She had a really helpful and thoughtful physical therapist who personalized her care and really catered to her needs. And it made her realize that she wanted to do the same for other people. So, career experience. Susan's been a physical therapist for over 37 years now. She's done a bit of everything in the field. She's worked in hospitals, nursing homes, and she's done outpatient therapy. She really loves to learn, and she's always expanding on her knowledge and continuing her education. Susan really advocated the fact that having good customer service skills and being an empathetic person and a good listener with good communication skills helps you further your success as a physical therapist. Susan works at a smaller clinic in a little bit of a smaller town, and she described how she enjoys it because she can always keep an eye on everything that goes on in the clinic at once. She also mentioned how a lot of older people find it more comforting and less intimidating this way. I also found it neat. She lets a lot of people come in and use the equipment during the week, aside from schedule appointments to work out, and that makes a lot of them feel more comfortable there rather than, say, an intimidating gym. So, patient population. When discussing the patient population that Susan usually works with, she said it's about 70% shoulders and 30% feet and ankles. Next door to the Athletico clinic that she works at is actually a foot doctor. So Susan gets a lot of her referrals through the next door doctor. She says that a lot of people enjoy this aspect because the care is more personalized to each patient. And the foot doctor next door will often pop his head in and check on his patients to see how they're doing. And people enjoy that thoughtfulness. Susan also explained to me how she enjoys working alongside the foot doctor because she learns a lot from him. She also touched on how much of an impact insurance has on treatment plans. In some cases, they'll give a time span for a certain amount of treatments. And if it doesn't help, they'll go back to the doctor, evaluate, and then make a new plan of action moving forward. When talking to Susan about the workouts, exercises she does with her patients, she explains how she has to utilize the clinic to its full potential. She says that they use every inch of the building, even including using the lobby space to mimic volleyball playing by bouncing a ball off the walls. And when hearing about a patient's problem, she has to be creative in what to use in the clinic to help mimic the issues they're having at home. Overall, Susan points out that the fact that the number one priority is effective, personal, individualized care. If there's something she thinks that she's not able to handle or maybe has some limitations, she doesn't hesitate to refer them elsewhere because it always comes down to the best possible care for your patients. So, wrapping up the interview, I asked her what her best advice she would give a physical therapy student after being in the field for 37 years. And the first thing she said is exposure. Doing things such as volunteering, unpaid internships, and just really getting knowledge and familiarity with the field will help make your resume look good and help further your career and set you up for a good foundation with physical therapy school. And